Well, we all know we're in the middle of a global pandemic, and now experts are warning of a measles outbreak in the coming months because of a decline in immunization coverage around the world. For more, we're joined by infectious disease physician Dr. Zain Chagla. Thank you so much for being here, doctor. So far, delayed vaccination campaigns in 26 countries have led to 94 million children just missing scheduled measles vaccination doses this year. Give me context. How dangerous is this?
Yeah, I mean, the global interest in infectious diseases has gone up significantly, obviously, in the last year. We talk about, COVID-19, the reproductive rate, 1 to 2 people. Measles is the most infectious pathogen known to man. It's thought that a single person can infect 20 other people. Being in a room with someone with measles and leaving, and that person being in the room 2 hours later is still infectious. And so, our vaccine campaigns here are incredibly critical. This is a disease that favors the young, and particularly the young and malnourished, the developing world. And so, this is one of the major global consequences of what's happened, with COVID-19 taking the global spotlight, that campaigns for routine things have come to the wayside and really do need to be caught up on as the pandemic slows down.
Well, explain this one to me, doctor. In 2019, there were nearly 1 million reported cases of measles. That was the highest number in 23 years. But cases are down this year. Why is that?
Yeah, I think you have the progress. This is a disease that goes through communities, so you have the progress of the years before. There is some effects of what we're doing with COVID-19 for measles in the sense that we're not assorting in very large populations. We're, distancing, we're masking. Even in the developed world, they've gone through a number of lockdowns, which have really tried to keep people at home, which has lowered infectivity. But again, this is a ticking time bomb. So, the fact that you haven't vaccinated a cohort means that once things start opening up, and knowing how infectious this pathogen is, you're going to see that drive to growth and drive to outbreaks. And so I would not be surprised in 2021, you see a number of measles cases that is incredibly high compared to the years past.
So you're concerned that next year is going to bring a higher level of outbreaks?
Yeah, exactly. Immunizations don't work right away, but they work for a population as long as they're strengthened. The second you see holes in the herd immunity within a population, which we've been talking about so much, the second you start seeing outbreaks hit them. And again, this favors countries that have very scarce health resources where immunization campaigns are already difficult. They're gonna feel the brunt of this more than us in the developed world.
All right, doctor, for my last question, I am anointing you the chief medical officer, premier, and prime minister. You have all the power. What action needs to happen right now?
Yeah, I think that's it. So, from us, from a global standpoint, we need to actually reach out, support these campaigns, either fiscally or through volunteer efforts to really get them off the ground. I think as we talk about moving out of the pandemic, the low and middle income countries that are hit the most really do have to look back at their health system's needs and what they need to fix pronto before they need to move on. And I think us as a global environment need to support that growth, whether it's being on the ground or whether or not it's being fiscally with it.
Doctor, great information. And just because we have our eye on one ball doesn't mean we can't and shouldn't pay attention to another. We appreciate your time today.
No problem. All the best, Ben.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.